Hello everyone, welcome back to our channel. I'm Dr. Lekashri Anbarasan, and today I'm here with a four-step approach designed to sharpen your skills and to ace your exams under pressure. And today I'm here with an example emergency test scenario. This content is purely educational. It is not a substitute for professional medical judgment or current institutional protocols. All right, let's look into the test scenario. We have a 68-year-old man presenting with a classic high-risk symptoms, sudden onset severe tearing chest and back pain. Look closely at his vital signs. He has a wide difference in blood pressure between his right arm, 95 over 60 millimeters of mercury, and his left arm at 140 over 85 millimeters of mercury. He is also tachycardic at 115 and slightly tachypneic. The critical question is, what is the most appropriate initial investigation to perform before beginning definitive medical management? Let's decode this scenario now. Let's look at the key pointers. His profile: he is a 68-year-old man, a classic demographic, and a high risk for vascular events. And the chief complaints: sudden onset cheering chest pain and a massive difference in the blood pressure over the both limbs. And he is hypotensive, such as hyperperfusion with a high heart rate, is a textbook presentation of an acute aortic dissection. Therefore, the central problem demands immediate action. Let's focus on why the other options are inappropriate. So let's keep our provisional diagnosis as an acute aortic dissection. In this case, chest X-ray is non-specific and it delays the definitive management in this case, which is immediate surgery. And ECG is required to rule out a myocardial infarction, but in this case, being a provisional diagnosis is aortic dissection, ECG doesn't diagnose the aortic pathology. And D-dimer is irrelevant because anyway, it is going to be positive in this case, but it doesn't give our team any details on the further treatment on surgical management. And transthoracic echocardiography is very useful to identify if there is an imminent complication like cardiac arrest, but it doesn't give a necessary comprehensive information on the anatomical mapping required for surgical planning for a type A dissection. Therefore, the critical diagnosis requires a definitive gold standard investigation. Given his signs of unstable vitals, it is a type A aortic dissection, and CT aortogram remains the fastest, most sensitive, and most definitive investigation in this case. To summarize, we successfully applied our four-step approach. Step 1, we identified the patient is unstable and he requires an immediate definitive step. And we spotted the keywords like sudden onset, tearing chest pain, and a difference in a BP across the limbs and unstable vital signs. And we have come up with the textbook diagnosis of acute aortic dissection. And step 3, we ruled out other options. And step 4, we arrived at a diagnosis knowing how critical is the scenario and how immediate and a definitive management is required and what investigation can be done in this scenario. Yes, and a consistent application of this structured approach ensures critical information is never overlooked under pressure and it helps maximize your score. Thank you for joining us in this 4 step approach. We hope this has strengthened your mastery on a difficult topic. Don't forget to like, share, and subscribe for more educational content. We love hearing from you. Drop your topic suggestions in the comments below for future videos. We'll be back soon. Until then, keep studying hard and we'll meet in the next video. Thank you.